Quebec's health minister has said that no wait in a hospital ER should exceed 24 hours. Well, given the state of our current healthcare system, that's easier said than done. Well, perhaps we could follow an example from Sweden. Jasmin Guénette is with the Montreal Economic Institute, and welcome. I want to ask you about the Swedish hospital. I mean, even within Swedish hospitals, this is exceptional. But they were saying that the median wait time in this particular hospital is 26 minutes.
Yes.
How, with us looking at it, how is that possible?
Can you imagine? I broke my wrist this summer and I waited 5 hours at the emergency room. And over there, you only wait 26 minutes.
How is that possible?
I guess many factors are in play, but they are just applying basic economics. Like Quebec, Sweden has a universal healthcare system, meaning that everybody, rich or poor, receive the treatment that they need. But in Sweden, they have public hospital and state-run hospital, and they also have privately run hospitals. And so what happens is that hospitals are in competition among themselves, and so they are always improving. They want to make sure that they treat people fast. As you said, it takes 26 minutes to see a doctor at Saint Göran hospital. In and out, people get treatment within 4 hours at this emergency room.
And I guess we should make it clear for people who are listening to this. So this, again, it's universal health care. These people are not paying for this.
Absolutely.
And so without paying for it, they're still getting service within 26 minutes, which is incredible.
It's incredible, yes.
What struck me, though, when I was going through the report, and the study that you did, is that it seems like everything that they do, we do the exact opposite. Where, for example, you say that they like to give responsibility very locally to the departments, to the hospitals, whereas we have a very centralized system which lies in the Quebec ministry and doesn't seem to be working.
There's a great deal of decentralization in Sweden, and especially at this hospital. The management of the hospital, they like to say that the company is built from the bottom up, that everybody who is working within the hospital have their say in what's going on, how to treat patients. Compared to Quebec, where it's top-down approach, we see the minister involved in many tiny little decisions on a daily basis. And it's very different from what we are seeing in the province of Quebec.
But it's interesting because here we have this idea that if privates get involved, if there is competition, automatically somehow the patients will suffer. This is what we've been told over the years, and you're saying that actually the economic model works for hospitals.
And also Saint Göran Hospital, like many other hospitals in Sweden and especially in Stockholm, they poll their patient.
They measure everything.
They measure everything. In Quebec, not only 25% of all hospitals poll their patients once a year. In Sweden, you have to do it every year. It's mandatory. And at Saint Göran, it seems like it's not enough to do it once a year. In some departments, they are polling their patients, a few times a year, because they want to know exactly what's going on, how people are treated, if they like it, and not only for the patients, but also for the staff, the employees. There's a high level of satisfaction from the employees.
Because they are consulted and given responsibilities.
Yes, absolutely.
Well, here's hoping that the Quebec government will pick up on some of your ideas from your study. If you want to find out more about this study, it is available on the Montreal Economic Institute site, IEDM.org. And it was very interesting. Thank you so much for being here.